Okay.
Your doctor has recommended you have a colonoscopy. This test looks at the inside lining of your intestines, so you will need to do a clean-out. Several days before you're scheduled, you need to go to the pharmacy or a grocery store to buy the items you'll need. At the store, you'll need to purchase a package of Dulcolax tablets. The smallest they come in is 10 tablets. You'll need to take 1, 2, or 3 tablets depending on the age of your child, and we'll tell you that in person when we come in. You'll buy Miralax powder. This is a laxative. It comes in a 238 gram bottle. You can also buy the generic version. It will come in a 255 gram bottle. The generic products are just fine, and they do cost quite a bit less. There are some patients who have insurance that will cover the Dulcolax and the Miralax. If that's the case, the doctor will send a prescription to your pharmacy, and you'll pick them up at the pharmacy counter.
So you will also need to purchase sugar-free lemonade or iced tea, such as Crystal Light brand, and you will need a 2-quart pouch. Any brand of sugar-free lemonade or iced tea is fine though. And if your child doesn't like any flavors, you are fine to mix this with 64 ounces or 2 quarts of just plain water. They also have Gatorade powder that can be used, 2 quarts, to be mixed with the Miralax. If you do decide your child prefers iced tea, we do recommend that you purchase the decaffeinated iced tea because your child will begin drinking the Miralax and iced tea solution at 5 p.m. into the evening, and this may interfere with their sleep because of the 2 quarts of caffeine. The day before the procedure, your child will also need to be on a clear liquid diet. The clear liquid diet consists of water, apple juice, white grape juice, white cranberry juice, clear broths such as chicken, beef, or vegetable, Jell-O, popsicles that are free of fruit chunks, Italian ice, or freeze pops. You will need to avoid anything with the color of red, so no fruit punches or things like that, because the red dye can stain the esophagus or colon and make it more difficult to determine exactly what the problem is when they're having their colonoscopy. The clear liquid should be started as soon as the child wakes up the morning before the procedure. So the day before the procedure, your child can have these clear liquids until midnight, and then after midnight they can have absolutely nothing by mouth, not even a sip of water, and this is very important because they will be having anesthesia. It's important that your child drink as many fluids throughout the day as possible to help them stay well hydrated because they will be doing a lot of stooling.
The afternoon before your procedure, you will start your prep. The first thing you'll do is take the Dulcolax tablets, whatever amount has been instructed at the office appointment. At the time you take the tablets, it's the best time to mix your Miralax solution. So you'll need the Miralax, you'll need a 64-ounce container, and either your Crystal Light, your Gatorade, or the plain water if that's what you choose. It's best to put about a quarter of the container full of lukewarm water, and then pour the Miralax into it. Miralax will dissolve well in the warm water. It will take a few minutes. Just shake it around or stir it. When you see there's no more Miralax visible, then go ahead and add the Crystal Light, and then fill the container full with cool water. You can then put this in your refrigerator. It'll be 2 hours before you'll start drinking it. It's important that whatever time you start, that you take your Dopalex tablets and start drinking 2 hours after that time. This will give the solution 2 hours to cool down, which will make it taste a little better.
So if you have a parent that is working and you're unable to mix this solution mid-afternoon, it is okay to mix it right before 5 p.m. But it would be much more palatable or easy for your child to drink if you add ice to it. And then they can drink it beginning at 5 p.m. So once your child begins drinking the Miralax solution, they should drink an 8-ounce glass every 15 to 20 minutes until the juice is gone or the bowel movements are clear and free of food particles. If they experience nausea, then you may slow down the space of time between the drinks to about 25 to 30 minutes, but try to encourage them to continue drinking. We also advise that you may want to stop the extra clear liquids during the time they're drinking the Miralax so that they don't feel too full and bloated. And as soon as they start passing stool, they can start taking in these extra items like popsicles and other juices if desired. It may take several glasses of the Miralax solution before you start feeling the need to pass stool. So don't be alarmed that it's not working. It will kick in. If by 9 p.m. The stools are still not clear and you're still seeing food particles, then you may give your child magnesium citrate to help clear the rest of the food out of their intestines. This comes in different flavors, but the clear citrus brand is a good choice. And depending on the age of your child, we will instruct you as to the amount they should drink. The younger children, 7 to 10 or so, should drink maybe 4 ounces. And the older teens can drink 5 to 6 ounces. And this will help clear the rest of the food out of their system. You can give your child clear liquids again until midnight, and then at midnight until after the procedure, your child can have absolutely nothing to eat or drink, not even a sip of water until after the procedure.
You'll have an opportunity to ask us any questions you have about this prep, the procedure, or anything about the appointment that you just had with your doctor when we come in.
Thank you. I hope this was helpful.